Hello and a very good morning, everyone, especially to our panelists, moderator, and all the audiences today. Welcome to the COVID-19 and Beyond the Future Forum. In conjunction with the National STEM Month, University Malaya organized this forum to discuss on COVID-19 and how higher education institutes in different countries adapt to the current situation. Before we start, here are a few reminders. First, fill in the form for attendance the form will be given by the Secretariat in the chat. Do fill in that form for your e-certificate. And secondly, feel free to ask questions in the Q&A feature at the bottom of your screen. And the questions will be answered by the panelists at the end of the session. All right. So today we are very blessed as we have representatives from 3 different countries to discuss on this issue. Before I pass the time to our moderator, Dr. Azlin, let me first introduce the panelists. So the first panelist is Professor Dr. Muhammad Yazid bin Jalaluddin. He is the Deputy Dean for Undergraduates of Faculty of Medicine, University Malaya. He received his Bachelor of Medicine and Bachelor of Surgery from the University of Malaya in 1997 and joined the University of Malaya as a trainee lecturer in 2000, then followed by as a lecturer in 2004 and senior lecturer in 2007. He began his postgraduate timeline when he received his Masters of Pediatrics in 2004 from University of Malaya and subsequently completed his fellowship in pediatrics, endocrinology, and diabetes at Children's Hospital of Philadelphia in 2009. He was awarded as a certificate pediatrics endocrinologist by the National Specialist Register Malaysia in 2010. While serving as an academician, he also serves as a senior consultant pediatrician and senior consultant pediatrics endocrinologist at the University of Malaya Medical Center, UMMC. Our next panelist is Dr. Panida Suksimuang, a lecturer at the Faculty of Liberal Arts of Prince of Songkla University, currently holds the position as the Assistant President for Student Development at PSU. She graduated from Oklahoma State University, USA, with a PhD in interdisciplinary education. Previously, she held several managerial positions related to the enhancement of students' well-being and students' development, such as Assistant President for Students' Affairs and Assistant President for Student Welfare. As Assistant President for Student Development, Dr. Panida Suksimuang has a significant role as the empowering person who continuously enhances PSU students' development in many aspects. She encourages students to adapt to their skills to help the local community while also participating in a number of active global networking. Moreover, under her tenure, PSU students have the chance to become excellent global citizens by acquiring a variety of talents through various outside the classroom activities, which are strongly supported by the PSU internationalization strategy. Our third panelist is Dr. Inken Nadia Dinianti Lubis, Vice Dean for Research, Community Engagement, and Collaboration at the Faculty of Medicine, University of North Sumatra. She received her Doctor of Medicine degree from the University of North Sumatra in 2006 and joined Department of Pediatrics at the same university to complete her residency and master programs, to which she completed in 2012. Her postgraduate journey continues with an awarded fellowship in the 2013 by the Indonesian Pediatric Society in Pediatrics Infectious Diseases Fellowship at Oxford University Clinical Research Unit in Vietnam. Subsequently, she pursued for a Netherlands tropical course focusing on international health in the same year and completed her PhD at London School of Hygiene and Tropical Medicine, United Kingdom in 2018, with her doctorate project emphasizes on malaria epidemiology and drug resistance in Indonesia. While serving as the course director for Master in Tropical Medicine at the Faculty of Medicine, University of North Sumatra from 2019, she's also the young representative from Indonesia in the European Society for Pediatric Infectious Diseases. Our next panelist is Dr. Clara Davina, dedicated 25-year-old pediatric resident with passion in community services and research. Bringing strong communication skills and professional attitude, she's committed to provide patients and health workers with the best care possible. She is excellent with time management skills and a solution-based leader who works well under pressure and with other medical professionals. In 2020, she is the first winner for the e-poster competition with the topic Comparison of Nasopharyngeal Swab and Saliva Sensitivity in the Detection of SARS-CoV-2 Infection in Boarding School Children. And last but not least, our panelist is from University Malaya itself. Mr. Tan Keng Hong is a current student in Bachelor of Civil Engineering of University of Malaya. While carrying out the commitment as a student, he is currently the Secretary of Current Affairs in University Malaya Students' Union, which is in charge of raising awareness towards social issues. So those are all our panelists for today. And I'd like to pass the time to Dr. Azlin, our moderator, to continue the program today.
Thank you, Abisa. Assalamualaikum and good morning, everyone. Thank you for joining us today. And also, we are very fortunate to have our distinguished panelists today to discuss the topic of COVID-19 and beyond, the journey. So as we know already, the past 2 years, we have seen significant changes in many sectors, including the education sector. The pandemic has forced the education sector towards digitization, remote learning, innovation in virtual teaching and learning, mobility, virtual internships, and even marketing strategies. So it's very good to see that our, higher education institutions are embracing change, despite the challenges of the pandemic. So today, we will discuss issues related to challenges and implementation, and I will begin with asking our panelists today some questions. And of course, this will be a very casual chat for this forum, and later on, I will welcome questions from the participants or the attendees of this forum. So our panelists, thank you for joining us today. Again, the pandemic has been going on for almost 2 years now, and students had virtual learning for the past 3 semesters. What are the plans for the next session? Are we still going to conduct virtual learning or hybrid? Perhaps we can start with management perspective. Prof. Yazid, can we have some of your thoughts on this matter?
Thank you very much, Madam Chairperson. Before going on to that, I would like to thank the STEM Center, Museum Malaya, as well as the Ministry of Higher Education for inviting me to put in some ideas and sharing thoughts with the panelists on this COVID-19 and beyond, the journey. Also, thank to Abizir for the kind introduction. So we all understand, we all know by now it's almost 2 years that our students has been having a virtual kind of learning. if I were to bring you to the Faculty of Medicine, for our clinical years, most of it are hybrid. And when we talk about hybrid, meaning that they have their lectures and tutorials mainly through the online, but because of the nature of their medical education, some clinical exposures are needed. So for that part of their study, they still have this face-to-face learning. And for the preclinical years, basically the stage 1 and stage 2, mostly these are done virtually, both year 1 and year 2, even in medical school in Malaysia and University of Malaysia, they are having their learning at home and they have not been meeting their friends. So it is somewhat at a disadvantage, but I just had a meeting with the top management yesterday, and top management has planned to bring all the preclinical year students to campus, and continuing with face-to-face learning starting middle of October 2021. So all the year 1 currently going to year 2 will be coming to campus, as well as the new intake of year 1. So the students will be having face-to-face, will be meeting their friends throughout the next semester and the next year. And this is not just for the clinical student or the medical students under the Faculty of Medicine. This also include students who have all these what we call as lab-based learning that is embedded in their program. They are expected to continue with face-to-face learning starting mid-October as well. And the University Management really hopes to bring all these year 1 and year 2 students on campus, staggered, slowly, bit by bit from mid of October, to give them the opportunity to feel the campus life, which they have missed over the last 1 year. So that's what is being planned by management so far.
Thank you, Prof. Yazid, for the very detailed explanation about the plans of What about from Dr. Inky, from the Indonesian perspective? Could you share your thoughts?
Thank you, Aislinn, and thank you again for the invitation. I mean, I could say, like, although like the pandemic has been happening for almost 2 years now, the situation can be quite different for every country, and even for Indonesia, like within the same country, the situation is very different between areas. So, like, we just went through a catastrophic wave 2 due to the Delta variant, and although like cases reported nationally has been decreasing in the last couple of months, this is actually only true for Java and Bali, because outside Java and Bali, like the cases, the wave just started a bit later. So for example, like North Sumatra province, where our university is based, like the cases are still at the peak at the moment. So like for us to plan for the next semester about how would the learning process would be, it's still quite difficult, because like you're still facing like so many cases and full hospitals in our province. But the Ministry of Education in Indonesia have recommending offline learning to start in October 2021. I personally feel this is not the best decision for some provinces in Indonesia. And we realize that we have the negative impacts by this long learning of virtual learning. But so we also have started some hybrid learning, just like Professor Yazid mentioned before. But this is mainly for the scientific faculties, and also for faculty of medicine. It is quite the same, where for preclinical years, we do a full virtual learning. But at the last years, so like for year 3 and 4, where we have some very important practical laboratory classes, then we would do it offline. But for the clinical years, then we are still doing it we are still doing it face to face, but with a very strict health protocol and limited time at the hospital. yeah, and we are still improving like the infrastructure in the faculties and make some regulations so we can really support when we are going to do the face-to-face learning later. But at the moment, we are still going to do mostly virtual, and we will evaluate again in the coming couple of months, I think, when the cases are more steady and the prevalence is quite low in our province.
Thank you, Dr. Inke. Yes, as we can see from our panelists' responses, the challenges are different here according to the situation. Of course, the recent wave in Indonesia has caused everyone have to move virtual learning for a longer time. Yeah, but of course now in Malaysia we are slowly admitting students. Because last semester, the university had allowed students to be on campus, and we've seen many COVID-19 cases in UM and other universities too. So if students are allowed to go back to campus for the next session, what are the plans to prevent the spread of the virus in campus? Perhaps we could have Dr. Panida share your thoughts on this first.
Okay, thank you very much, Madam Chairperson, and thank you very much for your invitation. I'll tell you about the situation in Thailand, especially my university. If we are going to bring the student back on campus, the university administrators, has launched a meeting every week in order to find the best solution for the student to be back on the campus. So we come up with, all the students who would like to be back on campus, we are going to provide vaccination, at least 2 doses of vaccination, and they have to follow strict measure of COVID-19. And we are thinking not allow, everyone to be on the campus, just the first year student and the fourth year student to be back on the campus. And we are evaluate the situation every day. Maybe if all the students have been vaccinated, we might allow all of them to be on campus, and we are going to assign, a quarantine place for the students who are from the red zone of pandemic. So we are going to lock them, in one place for 14 days in order if they are from, the dangerous zone. And we are doing this. During this time, we are also doing this. We haven't had any infected case on campus with that measure. And for the past 3 semesters, for the first semester last year, we have hybrid. And for the second semester last year, some students were studying on campus. And we didn't have any infected case, luckily for us. And for this semester, we are going to finish the first semester soon. We 100% online, and the students complain a lot. They don't like online courses, and we are thinking about the second semester. Hopefully, if the situation is better, or the student will be back. Thank you.
Thank you for sharing from the Thailand experience, Dr. Panida. So yes, so in Thailand, so you are allowing students in stages. What about in UM? What are the plans in terms of preventing the spread of the virus in campus?
Okay, thank you for that. Going back to how we have experienced way back about 3-4 months ago in medical faculty, we are very lucky that we do have our own hospital. So we managed to vaccinate all our clinical students in April, May. So because of that, they were allowed to continue. The top management has allowed our students to continue their clinical exposure, and they managed to recently had their final MBBS exam for the final year. So moving forward, the top management of the university, as I mentioned earlier, are planning to bring in the year 1 and year 2 students together with all the clinical students Basically, the students that are going to be coming back to the campus are only the ones who are fully vaccinated. When we talk about fully vaccinated, that means they have had at least 2 doses of vaccines plus 14 days after the second dose. So these students will be again brought back in staggered with adhering to a very strict SOP. The important thing here is to have less crowded area, and as what Dr. Panida mentioned just now, you can't bring back everyone because the college would not be able to support every student. So that's the reason why university is hoping to bring in the year 1 and year 2 first, getting them to be acclimatized with the situation, and then slowly, hopefully bring back the other students along the way. But saying so, there's still a need to have them to be quarantined for at least 10 days before they start their study. This is all again depends on the current procedures, SOPs, because in our hospital, what we're doing now is that any patients that needs to come in to be admitted, whether elective, mainly elective admission, they would need the RTK antigen swab. So we may be able to do that to these students rather than quarantine them for 10 days. That will definitely incur cost. So when they are already in the campus, definitely they have to have this standard operating procedure followed, which include the physical distancing, the hygiene purpose, the hand hygiene, the face mask. This is mainly to reduce the spread of the virus. We also try and make sure, having to manage the medical students, about 400 over of them in the last a few months, whereby there is a peak of incident of COVID-19 in Malaysia. We have already known certain things that's happening. So we have that kind of experience. We know that students need to come up front if they were to have symptoms and they need to isolate themselves. Stay away from classes, but they still can continue online. However, they need to isolate themselves and get medical treatment if necessary. We have put a proper workflow on looking at these students who has positive COVID. They need to be quarantined, but they are all monitored. If they do not fall into the category 3, 4, or 5, they can just be monitored, what we call in we call it as Cosmos. That's a special program for that they will be called every day to understand what's going on with them. So a lot of things got to do with the standard SOP that the student needs to follow. Along the way, we try to loosen up some of those SOP, allowing them to have their some physical activity, jogging in the campus, to just make sure that their mental health are also been taken care of. So I guess different universities have different SOPs, but we are all still learning. But we think that at present, the SOPs that we have in is able to contain or to manage students with COVID-19. And I can say that the number of students with positive COVID-19, as we have seen so far in is very low, I would say. Yeah.
Thank you, Professor, for sharing UM's plans regarding SOPs for bringing our students back to campus. Our students are, of course, very concerned, and parents are very concerned about the situation, but the fact that has placed SOPs, procedures that need to be adhered to, I think should be comforting, I think, for those who are very concerned about this issue. And the fact that some normalcy also will be allowed for students to enjoy campus life, in this situation. So I think I would like to invite Mr. Keng Hong as well to listen to some students' perspectives about this issue. Yeah.
Yeah, thank you, moderator, and thank you for the invitation. All right, so if students are allowed to go back to the campus for the next sessions, I think the plans to prevent the spread of virus in the campus, the first thing we have to do is do a survey about a vaccination status of the students. Yeah, I believe that UM management have did a very good job on this aspect, and they did release a survey form for the students to fill in their vaccination, either they have done their two dose vaccination or not. So yeah, after surveying about the vaccination status, we can have a better planning on how do we conduct the back to campus project. Yeah. After that, I think UM also did a very good job on quarantine and health assessment. Yeah, so before we enter to the campus, so based on my experience, we need to quarantine ourselves in one residential college for about 10 days. So to ensure there are no symptoms, COVID-19 positive symptoms before we enter into the safe bubble of UM itself. So yeah, based on that initiative, we managed to control our COVID-19 cases in UM. And yeah, there are some certain efforts from the UM itself, which implementing a strict SOP, which means for standard operating procedures or health protocol, which ensure social distancing in the campus and to allow certain physical activity to be conducted in the campus as well. So yeah, I think for now, the plans to prevent the spread of virus is a very complete system in UM. So yeah, that's all for me.
Thank you, Mr. Kang Hong. So you can feel reassured, yeah, with the plans in place and students coming in without having to really worry about what it will be like, especially for our new students coming in the coming semester. Okay, we'll move on to the next question. Well, since classes were conducted virtually from March 2020, most laboratory and practical sessions were either conducted online or postponed. Many have speculated that this will affect the skills of the students once they graduate. Is this true? If this is so, what are the mechanisms to ensure that students will still have the same skills needed upon graduation, despite having to conduct practical sessions virtually? Perhaps Dr. Panida from the Thailand Perspective.
Okay, thank you. As you say, the fourth-year students, they are very special cases for the university. And the PSU president ensures that all graduates have to achieve the goals of education. And therefore, the Vice President for Academic issued an announcement related to the fourth-year student that yes, the healthcare students, for example, the student from the Faculty of Medicine, Dentistry, or Pharmaceutical Sciences, for the final year student, they are allowed to study on campus, but they need to have vaccination, and they need to have quarantine if they are from the red zone of pandemic. And for other students, for the fourth year from the humanities sciences, or the engineering student, they are also allowed, to study on campus if, they are conducting a final project. For example, the student from the Faculty of Science, they need to use, some equipment in the laboratory of the faculty. The universities allow them to do so. And then they have to fill in the application form, and then to send it to the faculty, and each faculty have to consider, carefully, and then report each case to the university. And if the fourth-year student, they would like to stay on campus, they are allowed to do so. But they have to stay, one room for one student. And then they have to follow the protocol, by the university. And we are luckily, as a Professor Dr. Muhammad said, that we also have the Faculty of Medicine in our university. and they give us some advice how to deal with the fourth-year students. And I can be certain that all the final year students, they are well taken care of by the university.
Thanks, Dr. Kanida. I mean, the fact that there are the plans in terms of allowing students to come into campus and to be able to apply skills that they have learned is very good, I think. Well, I'm also interested to know if there's anything in terms of virtually. Perhaps we'll ask Dr. Inki in terms of how students actually gain skills virtually and whether or not they are prepared for work environment later.
Yeah, of course, like the hands-on experience on practical and laboratory like are very important like for students, and the inability like to achieve these skills like during the virtual education would impact the quality of the students in the future. And for us, like this is like one of the challenges like for the university to ensure like the students would gain the best education they can receive. So like some of the skills learning have been replaced fully virtual. I mean, but we some of these like we thought the most important studies skills that we needed to be learned is still like conducted offline with the very strict health protocols, and including like limiting the number of students so we have more classes and frequent disinfection of the classes, and also we like the students and lecturers have to be tested prior to the class. But also for like clinical students, I mean, unfortunately, that our vaccination coverage is not as good as in Thailand and Malaysia. So most of the students are not vaccinated yet. Although like the lecturers and officers and for medical students, like they're being vaccinated, but for other students than the medical students, they probably haven't received their vaccination yet. So what we can do is only like doing routine testing like prior to the practical class or laboratory class, but also for the medical student who have been vaccinated, then we perform like testing monthly to because we know that the vaccine that we receive doesn't have a very high efficacy. So we routinely perform that to have like early detection of the COVID-19 cases. Yeah, like, and to improve like the virtual class, we gave like training for the lecturers how to give virtual classes, because like if not only the students but the lecturers also face problems at the beginning, and because they were so used to give education in the traditional way, like this like the old school like teaching. So we told them like you need to be more detailed about the process, like what they do in the laboratory or in the practical. And I think the most difficult one is to make a video, because like all the faculties were overwhelmed with the situation, and most of the lecturers are quite old, so they're not very good in technology. So most of them needed some help. So it wasn't only for the students, but the lecturers were, I think they also needed like more help than the students. So yeah, but we like during the second year, this is getting better, and we already make improvement with the video and all the virtual learning.
Thank you for sharing your experience for Indonesian perspective. Yeah? Yes, the fact that training is given not only to students on how to learn virtually, but also how to conduct teaching virtually is very important, clearly. So I think in the past few years, everyone is somehow getting the hang of it, and we are all trying to adapt to the situation as best as possible, and hopefully gain skills as well, because the issue just now is about gaining skills. I mean, for when they graduate later on, and whether or not virtually they can acquire the skills needed. So from your responses, Dr. Panida's responses, the fact that we had plans in place in such that to allow them to acquire the skills physically at the same time virtually is, I think, very good, yeah, for us to move forward in this situation. And of course, moving on to the next question, recently, which ties back to the issue of vaccination just now. Recently, there was an issue about students who refused to be vaccinated. What are the efforts of the university to ensure that every student is vaccinated before coming back to campus? Professor, perhaps you could share your thoughts on this matter.
Thank you again. I think as what was mentioned earlier, the top management together with our Ministry of Higher Education has actually sent out surveys. But in medical faculty, we have been sending out surveys to look at the vaccination status of the students way back from February, March, to understand whether they have received or not their vaccination. And we also actually asked in that survey, if you do not want to take the vaccine, what would be the reason? We want to understand whether it is because of a medical reason, because of lack of understanding of the vaccination, and so on. And because of that, I think we are able to identify some of those students who refuse, and were able to talk to them and also give some counseling in terms of trying to get them to understand why is it that this vaccination is really needed at the moment. Yes, we do have a few who refuse, but for that matter, we are actually putting up a proper workflow to handle these students who refuse to be vaccinated. Other than just giving them counseling, we also, as I said just now, want to understand what is the fear of them, avoiding or refuse to get vaccinated. And then from there, we then have a proper group of counselors and as well as our consultants to also speak to them and have further actions taken. We do not want these students to miss their classes. That's a main aim. And at the same time, we also do not want them to be exposed and get the COVID-19, and that may cause them to have a severe infection. As we know from now, as we know with all the evidence that we have, those who have not been vaccinated, they are at higher risk to be infected, and they are also at a higher risk to develop the severe category of the COVID-19 infection. So in a way, the management is helping them to avoid them from getting infected and getting severe infection. So severe morbidities because of that. So I think the students also need to see on that perspective, not just saying that they are being forced to take the vaccines. As for the medical students, what we tell them is that the nature of their work, basically the nature of their learning process that need them to meet patients, that makes them vulnerable, and that makes their patients vulnerable to them if they were to have COVID-19 positive. So they need to understand that, and based on their pledge as a medical student, they need to make sure that the patient's perspective is put at higher level than their own interest. So the patient interest is supersede the student's interest in this situation, and they need to understand that. And I believe this is what the top management are trying to do. We hope that by doing this and having a proper workflow of how to manage these students, this could be better in future. Yeah, that's what we are looking at present with regards to those students who refuse to be vaccinated.
Thank you, Professor. Again, the fact that top management's also trying to enforce the requirement of being vaccinated, but to understand their perspectives as to why they refuse to be vaccinated. I mean, that's a commendable effort, I think. And the fact that for students of the medical faculty, they are supposed to be more ready in terms of being prepared. So I think this is a good step towards ensuring that students are all receive the double dose of vaccination needed. And perhaps we can hear next from Dr. Clara, students' perspectives on this matter.
Okay, thank you, moderator. Thank you too for the invitation. I was very honored to be the part of this event. Greetings from Indonesia. Thank you, Professor Yazid, Dr. Panida, and also Tan Keng Hong for the student representative. As for me, we know that before the vaccine coverage in Universitas of Sumatra Utara is still relatively low. At first, the priority to giving the vaccines was for the health workers in the hospitals, then for the civil servants, and now for the students. Although when the first campaign goes to the lecturers, only 30% that want to be vaccinated. But now the coverage is getting bigger, and thankfully now all already being vaccinated. The provision of vaccines for students has been prepared from the university for this September. Well, all of them are expected to take part in the vaccination event. Of course, the university department also always conducts webinars or educational events about COVID-19 regarding how to transmit COVID-19, early detection of it, and its prevention by vaccination. We know that vaccination is the best option before starting educational activities in the university area. This September, Universitas Sumatra Utara is planning to administer vaccines to students with targeting 1,000 to 1,500 students each day by involving the students' government in promoting the event and also volunteering for vaccination events. And after being listed by university, some who still have the high risk of COVID-19 will still undergo online education learning, while those with low risk can undergo face-to-face learning immediately. At last, we hope that with this program, all students from Universitas Sumatra Utara can be vaccinated. Thank you.
Thank you, Dr. Clara, for sharing that. I mean, it's very interesting to hear that there's a lot of awareness campaigns going on to raise students' awareness about the importance of vaccination, which links to the next question.
Sorry, Madam Chairperson. Sorry, can I just add a little bit?
Of course.
When it comes to students in our preclinical years, because they are not in campus, so they are at their home, basically. In Malaysia, I think the vaccination process is quite rapid, I would say, quite fast. But we do, under the top management, we do try to find this group of students who have yet to be vaccinated. And for that matter, once we know where they are, we try to work with the state areas vaccine center, or we try to work with our own University Malaya PPV, vaccine center, as well as UMMC vaccine center, to bring them in for vaccination. So it's not just based on their what we call now as the My Sejahtera. Yeah, in Malaysia we have this program, the My Sejahtera program that they need to register. But on top of that, if they do have some issues in getting, despite being registered, we try to bring them in to get their vaccination through different ways that we already have. And I think this is important as well, not just to let the students find themselves the vaccination, but the universities are well aware that some things could also be done to help the student get their vaccination. Yeah.
Thank you for sharing that, Professor. Surely, I mean, with such efforts to trace students and to ensure that they are not left behind, in terms of not only about awareness, but also in receiving, in helping them get the vaccination needed, especially for those who are unreachable in areas that are, far from getting access to vaccination. Thank you for sharing that, Prof. Yazid. We will move on to our next question. Combating COVID-19 is everyone's responsibility, not just the healthcare sector. How are the panel universities contributing towards this fight against COVID-19? Perhaps we can hear from students' perspective. Mr. Kang Hong.
All right, thank you, moderator. So from the view of a student in UM, so I believe that how UM contribute to this fight against the COVID-19 is they do have an initiative to set up a quarantine center within UM itself. So basically it means that we make one of our residential college as a quarantine center. So we do not send our student for others healthcare sector for the quarantine. Yeah, so we will be the one handling the quarantine procedures. So it does reduce the burden of the health sector. Yeah, I think UM did a very good job on this matter. And beside that, UM itself also do have some student health clinics that provides swab tests, which when we realize they are a close contact with a positive patient, yeah, UM does provide a free swab test for the students within UM itself. So yeah, we don't really rely on the other healthcare sector outside. So yeah, it makes the procedure fast and easier for the student to access to. Yeah, beside that, I believe that like what Dr. Kara, Professor Yazid say, vaccination is the prevention of whole transmission of this virus. Yeah, so UM itself also do have some vaccination programs ongoing. In our examination hall, we make it as a PPV, which means for vaccination center, and also in our university hospital, PPUM, they do have initiative for the vaccination as well. So yeah, based on this initiative from our university, we did contribute quite a lot to the fight against COVID-19. And yeah, like what Professor Yazid said just now, we also come up with some initiative, like do some survey among the students to investigate the vaccination status among the students. And yeah, we are planning out like how we can approach a student who haven't received their vaccination. And when we have go to campus session going on, so we can arrange vaccination in their own state vaccination center, or even in our UM vaccination center as well. Yeah, I think that's all for me. Thank you.
Thank you, Mr. Kang Ho. Yes, with regards to survey, I think that's very important for us to understand the status. And what about Dr. Inki? What do you think?
Yeah, so at the beginning of the pandemic, like the university created a COVID-19 task force with several job descriptions, including like preparing the faculty for offline learning, like it's including like the preparation of the infrastructure, data collection of all the lecturers and students about their comorbidities and vaccination status, and also preparing like each faculty to monitor the health of their faculty members. And also the university collaborated with the district health office to give vaccinations to the university members. So in March, we gave vaccination to 4,000, almost 4,000 of our lecturers. And it was done like 2 times. And in this September, just like Dr. Clara said, that we are going to give like a vaccination program to 21,000 of our students out of 50,000. So hopefully that we can already give half of the students vaccination, and then before the end of the year, we can vaccinate all of our students. And also like the university made some regulation, including like 25% to 50% of working from home, while for the officers and lecturers, while for the students, it's still all virtually, except for only for the faculty of medicine. And we also accommodate for all the university members who have COVID-19, or if they having a close contact with a COVID-19 patient, then they can be tested in the university hospital or at the Faculty of Medicine. Like the family members can also be traced, and if they are positive, then they will be monitored by the team of the university until they are released from the self-isolation, or if they need to be referred to the hospital. Unfortunately, until today, I think there are not so many involvement with the students, because it is quite difficult to be involved with the students when they are doing the education virtually. So, I mean, at the moment, like we have a very limited interaction with them. And we also try to, because for 3 months now, we have like a lockdown in North Sumatra, and also at the beginning of the pandemic. So we want to limit their mobility. We don't want them to be coming to the university, because like the cases are still very high. So most of the efforts are only done by the officers at the moment. But for this vaccination campaign to the students, we also involve the student body organization, so they can also promote the students. And I just hope that the students won't be too excited coming for the vaccination, and also to meeting their friends and cause like so many like a crowded meetings, and can increase the transmission of COVID-19.
Okay, thank you, Dr. Inke. The fact that there's a lot of collaboration there with not only district health office, but also student bodies, I think it's very good, yeah, to encourage student vaccination, of course, staff vaccination as well. And what about Dr. Panida? What do you think in terms of contributing?
Yeah, I mean, as Prince of Songkla University is the regional area, so the university works closely with Songkla Provincial Public Health Office. We luckily have, I mean, the Faculty of Medicine. So PSU doctors give advice to the university as well as the people in the province. We also set up field hospitals with 300 beds for infected patients. And university, I mean, has launched a campaign, do and don't, about COVID-19, and wearing masks all the time is enforced to all levels. That means if you are on campus, you have to wear masks, and you have to, we have a special application for everyone who entered the university to scan and indicate the time where you are and where the places that you have that you have been. In case there is, I mean, the infected case, the hospital will contact that person immediately. And moreover, during the lockdown period, if you heard the news since the April this year, there is, I mean, the super spread, I mean, of a pandemic. So the university set the regulations for working in the university and gathering to do activities to be aligned with the national emergency decrees. So the government announced, I mean, the national emergency decrees, the thing that we have to do and the thing that we have to follow. Moreover, a lot of staff, the university reduced the number of staff working on campus and use work from home policy. And then we will provide a place for student quarantine if they are from the red zone, as I mentioned, or they are close contact with the infected. We provide a special place for the students. But if they are infected, they have to stay in field hospital, Prince of Songkla field hospital. And for the vaccination, what am I going to say? I mean, a lot of students have vaccination, but in Thailand, as I said, can I say this? It is something like politics. I mean, a lot of people need vaccination, but few vaccination, I mean, are released to the people. And we try everywhere in order to have vaccination for the students. I mean, for the higher education, and then for the lower level of the student, because as everyone know that the student they study and they have to meet friends and they have to do activity with friends in order to release their stress. And because of, I mean, the limit of vaccination, so a lot of problem. I mean, there's a lot of problem. We also do conduct a survey of the number of students who have been vaccinated. A lot of students, they want vaccine, but there is no vaccine for them. And we are waiting for the vaccination from the government. And we hope that in the middle of this month, in the middle of September, there will be a lot of vaccines for the people. And then all the students will get vaccination. That's all.
Thanks, Dr. Panida. I mean, the fact that you have a proper, workflow and the field set up, despite the low, vaccination, in terms of getting the vaccination for everyone, it's a bit low rate at the moment, but it's okay, I think, since all the standard operating procedures are in place, which is, I think, very important. And this leads us to the next question. How does university?
Sorry again. I just
okay.
I just want to add a little bit. I think a lot of us talk about vaccination. A lot of us talk about the need for social distancing and all that. I think for us in university, whether from the medical perspective or the non-health friends and colleagues, we also need to understand that it's not just about the vaccine and the infection. We also have to look at what the communities, what's going on in the community, especially I would say the urban poor in Kuala Lumpur. For us in our department, I'm from the pediatric department. We do reach out to those communities to help them out, because I think during this trying time, there's a lot of issues with not able to get proper foods by these urban poor groups. And I think what we try to engage our students is to come and help. And we also try and engage our academic staff to pull up resources, having some donations, going and supplying some food to this group of poor urban community. And I think this is something that we, as the academic staff and students, can do to not just think about the vaccination and the fact that we are trying to fight against COVID, but we do need to look at people around us as well. And I think this is something that we have been doing and we have been actively doing through the department and through the faculty, helping out some of those poor urban communities around Kuala Lumpur. Yeah, I think that's something that we as people in university, not just academic staff, but students, need to think about that. Yeah.
Can I say something? Can I add something?
Yes, please, Dr. Panida.
Okay. I'll give you, I'd agree with Dr. Muhammad, and then the university also, give the food to the poor. We have the center for donation, and we usually give food to the poor. In the province, in the province, and also to other places. And we also have for the vaccination, we have classify the people. The poor will also have the vaccination. The staff from the Faculty of Medicine will reach that group of people. Okay. Thank you.
Okay, thank you. Thank you for mentioning these issues as well, Prof. Yazid and Dr. Panida. It's very important to reach out also. And the university plays a role in that.
Yes.
Not to leave it to the government to reach out to those who are unable to get vaccine, but at the same time are in dire circumstances. Yeah, and which leads us to next question. And this is, although we talk about strategies just now, in terms of virtual learning, but I think a concern is also how does university management tackle the main challenges of virtual learning. Dr. Fanida, perhaps you can share your thoughts on virtual.
Okay, thank you. Thank you. And I think we know that both lecturers, like me and the students, do not prefer virtual learning, but we can resist because of the pandemic. So the university management provides the platform for the student to study. For example, Microsoft Teams, Google Classroom, and Zoom. The university has brought Office 365 license for lecturers and students. They are free to use, Canva or PowerPoint. And also, the university has arranged PSU administrators live talk on Facebook to talk with the students and listen to their problems. And a lot of students, participated in that live talk. And I think that the most important thing during this period is communication. University provide more channels of communication, and then with that communication, we should have someone to react to the question quickly. So that what we have done. And then the other thing is, the most important thing for students is, the exam. We change the assessment. That means we change from paper exam to oral exam, for example, or other methods of evaluation. Therefore, this year, PSU have no midterm examination. And then for some courses, they might have, online examination. But we encourage the lecturer to use other ways of evaluation. And we also provide computers, renting computer for the student who don't have, the computer to study online. We provide a lot of money to the student. We provide scholarship, we provide, welfare, we provide insurance. And if the student are infected, they will get some money from the university. That's all.
Thank you, Dr. Panida. So a range of strategies there and how you implemented virtual learning. Yeah. What about Dr. Inke?
Yeah, thank you. I'm really amazed by the support that like the Dr. Panida just said. That's a lot of support to the students, and I wish that we can also follow your examples. And what we did was because we know like so many problems that the student faced before, including like the technical difficulties and distractions, and also like the socioeconomic factor, because they need to buy a lot of credits for their phone, like for the internet. And also some of them couldn't reach the course objectives, and also there's a lot of lack of interaction with the teachers. So in terms of internet access, the government gave free credits for the internet. So like the students can use that, although it was only given if the students use certain SIM card. So if they use different ones, so they don't get the credits. And for us, like the lecturers, we told the lecturers that they have to reevaluate the study plans. So what they did before, they have to reevaluate everything, including including about how they would teach the lessons, and about the materials, whether it can be given using video, so it won't be too boring of the lecturers giving just talks to the students all the times. And we also told them like to start with easier material, so like the student can adapt with the subject first before going to the more difficult subjects. And at the same time, the teacher should evaluate whether the students understand of the objectives of the course. So we know like how effective the virtual learning is. And it is still quite difficult. Like we don't have the student center, like where they can ask for support. We don't run our computers. So like before, like in the Faculty of Medicine, most of the tests is done computer based. And for students who doesn't have computers, they can go to the faculty and use the faculty at the computer laboratory in the faculty. But now, like with the pandemic, they're not allowed to go to the faculty, and they also don't have computers at home. So like most of them are just using their phone like to study, which is not effective enough. And some like for some medical faculty, some of the students probably have a better economic than other faculty students. But for like the other students who are going for the non-sciences faculty, probably they're poorer and they cannot afford to buy a computer, especially for students on their first year or second year. And we are very limited to give our support. So I'm really amazed what with the University of Prince Songkhla can do for their students. It's really good, and I will report this to the university board, and that we should also do that. Well, what we can do so far is just conducting the hybrid learning so like students can also learn when they cannot go, when they have limited access. But other than that, like we try to support, like we told the lecturers to try to interact as much as possible with the students so they can identify students with problems. And also we ask them, like now when every time they give lectures, like the students have to turn on their cameras, because at the beginning all the students turn on the camera, but now like after 1.5 years they started turning off because they probably are bored and they just want to be relaxed when they are learning. But yeah, that when they turn off the camera all the times, the lecturer cannot also identify like which students are facing problems or whether they were actually listening to the education. So yeah, that's what we are trying to do, like to manage the challenges in our university.
Thank you. I mean, in terms of challenges, I think all universities face that same situation. Yeah, I think there's this pandemic fatigue going on as well, where students are just, tired and they just want to learn, but it's so difficult with this virtual thing going on. But okay, perhaps Dr. Prof. Yazid probably can add on.
Thank you. I think when we talk about challenges, virtual learning, we have to look into a few different aspects. First, the infrastructure. I'm amazed what Dr. Panida mentioned just now. In fact, in from the top management, we do have a student fund. We do get some corporate donations for the fund. And what our Vice Chancellor mentioned is that this fund needs to be used. So it should not accumulate in terms of the amount, but the amount should continue to drop. Basically, these funds should be used. The students in need should be assisted, and students have means and ways of getting that assistance, either through their faculty or straight to what we call as the Hal Ehwal Pelajar, the student unit. Then they can actually fill in certain forms to get some assistance. I know that top management do provide some assistance in terms of the internet, the financial part of it to get a good internet access. And when we look at more than infrastructure, we all know when it comes to the personnel, both students and teachers do have some challenges because there's lack of interaction. That that physical interaction is not there, so you can't really know who is listening to you, who is putting in a lot of effort to learn and all that thing. And there are some initiatives that has been employed. I think if you look at student, basically for us in University of in the Faculty of Medicine, we do have pre-recorded lectures, and then these lectures are given much earlier for the students to learn before the lecture itself. So on the day of their lecture is a recorded synchronous session, meaning that during that period of lecture, it will be a lot of discussion between the lecturer and the student. And this is recorded because we would like the students to revisit for their own revision, and also to support those students who have some connectivity issues during that time. So it is important for us to do that to make sure that these students are not left behind. And for academic staff, I think the pre-recorded session allows the teacher to prepare ahead. And in this event, if there is any emergency, that the teachers, and mind you, the teachers that teaches the program in MBBS, they are also the clinicians in the hospital. And at one point, our hospital beds is nearly 90% full with COVID patients. Then that's when a lot of teachers has to be pulled away for the clinical work. And because of having this pre-recorded sessions, that will definitely ease the process of learning for the students. And from the medical education unit, they also provide support to these patients. As again, what Dr. Inke and Dr. Panida mentioned just now, I think the teachers needs more assistance when it comes to all this high tech compared to the students. So the support is readily available in terms of the guidelines is already there, and the faculty development unit initiatives are already there, and one-to-one assistance are provided basically for any teachers who need support. And for smaller programs under our Faculty of Medicine, we do have smaller programs under biomedical sciences as well as nursing. They actually have regular engagement between students and academic staff, and definitely this helped to alleviate some of these students' mental health issues. Some motivational talks were also done, and this definitely again play a huge role in uplifting their spirit, the student spirits. Sometimes with just talking, you can actually save a few. You can definitely save some of these students from going further into anxiety, into depression, and all that. And for Faculty of Medicine, apart from those that has mentioned Microsoft Teams, 365, and all those, Faculty of Medicine MCM Malaya actually also subscribe to some other online educational platform like Turio, BMJ, Best Practice. These are all there to help students to widen their horizon, widen their scope of learning so that they are not left behind. And I think it is very important that the challenges in virtual learning is not just on the students, but it's also on the academic staff as well. So the management needs to play, management needs to put up a lot of work to make sure that both parties actually are not left behind when it comes to virtual learning. Yeah, that's my thought on this. Thank you.
Thank you, Farizid. Picking up on what you mentioned about mental health just now, yeah, UM has been very cognizant of the fact that students are very experiencing challenges in terms of learning, and this affects their mental health, and of course other situations like the loss of the loved ones. So this brings us to the next question. How is the university tackling the issue of mental health? So I invite panel members to answer this question. Perhaps Dr. Inke, you want to share with us?
Yes, thank you, Aislinn. Yeah, like the mental health is a real problem, and unfortunately, like the university doesn't have like a student center, or even like for the staff, like where they can, like a call center where they can call wherever if they have any, if they face like mental difficulties. What we only have now is more like how to help with the physical illness, like instead of mental illness, although like COVID-19 probably affect both now. What we just started now, since we have the second wave in Indonesia, like the university started a telemedicine where we provide telemedicine for people who has a COVID-19, who are COVID-19 suspect or confirmed COVID-19. So we refer them if they're suspected, where they can be tested for free, or if when they are positive, like the doctors who are volunteers, they will accompany them for 10 to 14 days and see if they have any illness. So what we hope is like these volunteers would educate the patients, and we promote this telemedicine, especially for all the university members. We have some problems before, like for our students in Medan, where most of them are coming from outside Medan, and they share a room with other students in the hostel. And when they get infected, they have to leave the hostel. So we have to help them in finding a hospital, but like the hospital will only, because our hospital is mostly full, so they only accept patients with moderate to severe cases. So when they're mild or they don't have any symptoms, they cannot be hospitalized. So, but there are several students who have these problems because they share the rooms with more than one person, and sometimes like 2 and 3, and they cannot go back to their village or their town. So, and they're being abandoned on the streets sometimes, which is very sad. And so that's why we started this telemedicine, to help them finding a place to like for them to be isolated. And unfortunately that we don't have a place where we can accommodate these people to have self-isolation, because not only for the students, some of the staff also have some problems. Like Indonesia has a very big household. So in one house, usually the people, like there are like 6 to 8 people living in the same house. So when the one is positive, then like the family cluster would easily be happening. Yeah, so in terms of physical support, we are trying to support them, but instead of the mental health that we have, I think we are still providing a very limited service on that. And when the staff, the member of the staff or the students lost a family member, like we usually collect donation from students and also lecturers to support them. And usually we will involve some other bigger donation when they lost a parent, because we know like they will also lose the support, their financial support, and how they will continue their study. So yeah, that's so far what we do.
Yes, thank you, Dr. Inke. Dr. Panida?
Yeah, I mean, the university pays attention to this problem. I mean, before the pandemic, this problem is, is very important to us. We also, before the pandemic, we also provide training courses for the lecturers who are, taking care of the students. And then during the pandemic, we have hotline for students. We have special channel for students to go to the hospital. I mean, in serious cases, the student will be, directed to the hospital. And we have clinic for students. We call it in Thai the Center for Youth. But no one knows this is the clinic for the mental problem student. And in the center, there are a doctor, psychiatrist, and licensed counselors. And we also have Facebook, for counseling. And we are considering buying an application. It is called UGA application. We can use with iPhone or Android. This application are by the doctors, and this is just for the student who want to have some advice and want to keep their identity, and then they don't want anyone to know who they are. And this is the thing that we are considering. Buying this application. Yeah, this is what we are doing. And the most important thing is the teacher. As a lecturer, we need to observe and notice our students. And if we can notice some symptom early, this can help our students.
Yes. Thank you for sharing. Both the similarities there in terms of applying technology, so easy of helping students with mental health during this pandemic. Of course, if we could get some perspectives from the students' representatives. Mr. Keng Hong?
Yeah, sure. Thank you, Dr. Asli. So yeah, we always concerned about like people lost their loved ones and their financial problem and leads to mental health issues. So from the university parts, I think UM did do some subsidies for the underprivileged students. And yeah, and one more important thing that they do is like the campus are open to the students. So we will like classify the student into 6 categories, which the first one is like they have labs, clinical studio sessions. This is the first category. The second category is like they do not have internet access at home. They do not have enough resources at their town, something like that. Yeah, the third one is like the foundations and diploma person who already on campus, they are allowed. And yeah, we also open for categories like international students who going back, except some country are having peaks of the COVID-19 cases. And also we open for OKU, which mean people who has disabilities. Yeah, and of course we open for examination purposes, like we do have MET. MET is a Malaysian English test. So yeah, for professional papers. So we UM initiative is like we allow the student to go back to campus if they are needed. So under this 6 category, it actually helps the students to go to campus to solve their current situation, like they do not have internet access and anything else. Yeah, besides that, I believe that like what Professor Dr. Yazid said, we also have our quarantine center, and to reduce the financial burden of the student to quarantine themselves in their own pace. So yeah, UM did a free quarantine for the students if they are close contact with the person. Yeah, they have free access to the quarantine center. So yeah, for the mental health part, I believe that UM counseling center has been there for a long time. But yeah, we do have like channels for the student to access to. But for AMSU part, AMSU, yeah, maybe I can introduce AMSU. AMSU is a University Malaya Student Union, which is founded by our students. Yeah, so AMSU is currently working on some buddies initiative, which means we will build one buddy system along the line with UM Counseling Center, even PPU UM for some mental illnesses. Yeah, so that's how we going to tackle this issue. Besides that, I believe that student plays an important role, not only like a management are doing all these initiatives. So for my sharing is like student union, our student union in UM also come up with some initiative like laptop kita. So we did find sponsor outside of our campus, and we gather the money and we purchase those laptop for those who does not have laptops for online learning. So we will distribute the laptops to those underprivileged people for them to access to the online learning. Besides, we as a student union, we also do crowdfunding for those who lost their parents. Yeah, they do lost their sort of incomes. So we do crowdfunding and help out those students. So yeah, as a student union, we are aims to serve the students. And of course, we have free data plans, subsidy for the swab test, and we also distribute free food on campus. And we also like demand for reduction of fee, which we managed to reduce the fee of our course, like for 150 ringgit for 2 semesters, and we are currently demanding more reduction of the fee in the next semester. Yeah, so yeah, basically what UM and its student union are tackling is based on what I explained just now. Yeah, thank you.
Thank you, Mr. Keng Ho. I have to move on to the next question, which hopefully Dr. Clara can also enlighten us in terms of the efforts of students' associations. Yeah, this ties back to what Mr. Keng Hong has said earlier. What are the efforts of the student associations in educating fellow students about COVID-19? Dr. Clara?
Thank you, Dr. Azlin. The student association are actively engaged in providing education on COVID-19 for students. Regularly in Universitas Sumatera Utara, every Saturday and Sunday, webinars and various talk shows are always being held about COVID-19. The topic used is also based on the students' thoughts and their interest in the COVID-19 issue. Not only through the webinars, there are also many activities in the campus environment, such as distributing masks to students and lecturers in the campus environment actively. And we also held other events as a student activity unit from the 69th USU anniversary event. We holding educational poster competition, webinars from health experts, and also TikTok challenge. Each event held was chosen by what is comfortable and applicable for the students so that they are enthusiastic about doing it. In addition, we also use social media a lot, just such as Instagram and YouTube, to share the educational videos on how to wear masks properly, how to fight hoax about COVID-19, what to do during self-isolation, how to detect COVID-19, stories about COVID-19 survivors, and the importance of vaccines. We are grateful for the support from the rector and the dean and other faculty leaders in Universitas Sumatera Utara who always support and encourage the Students Association in every program. At last, we hope that this program will continue and prepares the students to be 100% ready to undergo the face-to-face learning process later. I would love to hear from Keng Hong too, from Student Perspectives.
Yes, Keng Hong, would you like to add to that?
Yeah, sure. So for the efforts from Student Association, UM Club and Society, they are facing like difficulty to conduct physical activities. So basically, all UM students are creative about this, and clubs and society in UM still are conducting some interesting activities through online platforms to continue like involve students in co-curriculum activities. So like besides that, about COVID-19 parts, all the association are aware about the COVID-19 and they come up with like guidelines and SOP, which is standard operating procedure that we should abide to. Yeah, they will blast it out in our social media to allow all the students are well aware about the situation now. Yeah, besides that, maybe I can credit to Faculty of Medicine, our UM MedSot, which is Medical Society, which they also do many webinar and article writing or even discussion series about vaccination, about COVID-19, how we tackle COVID-19, which increase the awareness about the student about the COVID-19 cases. Like what Dr. Kara said, we also do social media challenge. But our challenge is quite interesting, which is we ask the student to screenshot their vaccination booking and post it on the Instagram story. So everyone are well aware about their vaccination appointment and encourage among the peers to get vaccination as soon as possible. Yeah, that's all for me.
Thank you, Mr. Keng Hong, for sharing. Yeah, we can see how similar and different approaches are, but mostly similar. Yeah? In terms of, we are almost towards the end of the forum actually, so I would just like to ask one final question to the panel members, especially the management. How will this virtual learning affect students' employability? And how should industries prepare for future graduates during the pandemic? Prof. Yazid?
Okay, sorry. Thank you for that question. I know with virtual learning, there's a lot of lacking in interaction, and there may be some reduction in skills that may affect the employability of these students. If I may say, from the point of view of the medical students, we did have to actually do a lot of changes in terms of their teaching and learning. But all those changes that we have made still conforms to the quality standards that has been put up by the respective authorities. So despite them not having the 100% of clinical exposure like their seniors, we do still make sure that they actually achieve the bare minimum of what is needed for them to, in their future, in terms of, having a role as a healthcare provider. And I think for the other faculties, those who are science-based, who have lack of the hands-on or lab-based experience, I'm sure this may have some impact on their employability, but I believe this could be tackled by having some post-graduation empowerment program that's specifically looking at the empowering the students when it comes to their working life. This is something what our faculty is trying to do for these students. We try to come up with some programs, bringing them back in to have the pre-internship program. Then we have some empowerment looking at whether we can bring them in as the research assistants, at the same time expose them to how it works in the medical world. And also some of them who are happy to volunteer their time, we are actually opening up for them to come and volunteer at the vaccine center, or even volunteer as in-house medical assistants. This is something that we want and we are eyeing to, and hopefully this can be materialized. But I guess for the other faculties, something like this needs to be thought of, so that the students are not lacking in their lab-based or their hands-on experience when it comes to them needing to use all this experience for their work in future. Yeah, I think that's my take on that.
Thank you, Prof. Yazid. Dr. Inky?
Yeah, I agree with Prof. Yazid. Like some students probably won't gain as much as like their previous, like their teachers, and we are trying to accommodate this, and including like telling them like they will probably need more training after their graduation, and focusing on soft skills training, because during this pandemic they're lacking of interaction with other people, probably not very effective in communication. So we can identify what they're lacking of at this time, so they can improve it later. I'm sure that probably due to the pandemic is also that the students are more exposed with more subjects, because they're learning so much with this like virtual session, compared to like previous students who are learning more at the hospitals. But so they have a lot of knowledge, but they probably need more training how to implement that and how to communicate. And also the same with Prof. Yazid. So for students who has just been graduated this year, we recruited them to volunteer on this telemedicine. So although they are not facing the patients directly, but they can still also train how they communicate, how they do history taking, because during their clinical year, we really limit their exposure to the patient, so they can only observe, but only the residents can interview the patient. So I'm sure that it is quite difficult, but yeah, I'm sure like some training, like the students will catch up very quickly.
Thank you, Dr. Inky. Yes, Dr. Panida, would you like to share?
Yeah, yes, I agree with both of you. I mean, for Thailand, we have something like, we call it TQF, Thailand Qualification Framework, and we also have program learning outcomes. These two things, I mean, are strictly applied to help students achieve, the learning goals, and also for the I think that the bright side of pandemic is that the student they have to improve themselves. I mean, very quickly. They know that, I mean, what their problems are, and if they are going to work, they need to have not only the content or the subject matter in that field, they need to have something like multitasking skills. That is the requirement for industry and for large corporation. For example, the student who get a bachelor degree of English, they need to know, they need to have, multitasking skill, the skill of presentation, the skill of, using Canva, for example. And I think the university provide, the online courses, we call it MOOC in Thailand. And then we just, tell the student to learn, this courses in order to improve their skills. And also, I hope that the fourth year student, they will have a chance to go back to campus to learn, student life, and to practice, real life problem solving. I think this is for Thailand.
Thank you, Dr. Pranida. Thank you all panelists for sharing your experiences, your thoughts on the programs. And we know that our graduates, our students, undergraduate students all need to upskill themselves. They need to quickly, they need to adapt because of the situation, unprecedented situation. And we know that universities are really trying to ensure that students are able to join the workforce later on, equipped with skills needed. Before we end the panel session, we do have questions from, because time is running out. We do have questions, and I would like to forward these questions to panelists. Let's go to the Q&A first. There's a question from Indra. This is directed to Prof. Yazid. Besides vaccination and also social distancing, along with other SOPs, what else can students and staff do to be protected? As we know, people who are vaccinated also do come down with COVID-19. Can any supplements be recommended for protection? Prof. Yazid?
All right, thank you. Thank you very much for that. I think we all need to stay healthy. First thing first, there is no definite kind of like supplement for you to take to avoid COVID-19 or to prevent you from actually having complications of COVID-19. But staying healthy, be mentally and physically healthy is the first thing to do. You need to make sure that you continue to do the exercise despite all the difficulties, not being able to go out and all that. That will keep you in a high spirit, with the presence of endorphin, serotonin that's come out when you do exercise. That definitely helps you to sleep better. When you sleep better, your immune system is better. Although there are some studies that has just been published just two months ago, looking at vitamin D and the reduction in terms of COVID-19 exposure or COVID-19 infection in adults in the UK, it has shown that vitamin D, good amount of vitamin D is important. And again, when we talk about vitamin D, we know Malaysia, Thailand, Indonesia, we are all very near to equator. And if you look at the data that we have, even in Malaysia, we are lacking in vitamin D. And why is it so? Because we are not out there in the sunshine. We are always shy to this sunshine. Whenever we go, we have umbrella on top of us. Wherever we go, we try to find shades. So I think it's important for us to get a good amount of vitamin D through getting good amount of sunshine every day. If, let's say, you can't get that because of your nature of work, you have to get some supplement with vitamin D, or even making sure that you get enough dairy product every day with just a maintenance of just 400 units a day. You should be able to have a good coverage of vitamin D level and hopefully avoid the COVID-19 infection. And I'm not just saying this just to promote you on taking vitamin D, but there are some scientific evidence to show that when you have a sufficient vitamin D level, you do your body is able to avoid this COVID-19 infection. Although the study did not manage to show that there is a reduction in death related to COVID. Yeah, I'm not sure whether Dr. Inke has anything to add on that. Yeah, I think because she's with her background of infectious disease, I think she may have read more than me when it comes to looking at supplement for you to avoid COVID-19. Yes, please, Dr. Inke.
Oh, thank you, Prof. Yazid. I think I agree with you. Like you already mentioned it very well about the role of vitamin D in boosting your immunity. But as many as supplements you use, I think still the most important thing is protection for yourself, including like wear the mask and avoid crowd. Also, routinely perform the hand washing, and of course, like vaccination is the most important things. And yeah, I mean, if you then you can get these extra supplements like to boost your immunity, like vitamin C and vitamin D. And I think, yeah, that's all from me. Thank you, Prof. Yazid.
Yes, thank you for sharing your advice, yeah, from medical perspective, how we can all keep ourselves in top health, yeah, optimum health. And we do have one more question. Of course, this is directed to Professor again. It's pertaining to the environment in Malaysia. It's from Intan. If the non-vaccinee avoids vaccination with legal orders, any advice besides through sessions?
Okay, thank you for that. This is very difficult question. I think everybody has their own thoughts on this, right? Everybody has their own share. But when it comes to medical reasons, as I said just now, the medical interest of your patient supersede your interest. Then these things has to be looked into in that way. The code of ethics, being a medical student, yeah, medical students are also part of healthcare providers. So that has to be first in your whatever that you think about when you want to avoid vaccination. Okay, although it is not compulsory at present, but a lot of areas in Malaysia is making it compulsory. Even shopping complex, you cannot even enter shopping complex if you're not vaccinated. You cannot even enter, cinema. You can't go to places when you are not vaccinated. So the more reason we make sure that the medical students who are going to visit the patients in the hospital get vaccinated. I mean, if these social areas are making sure that you get vaccinated completely before you can come in, more so that this is needed for the hospital. And the fact that if you were to get the legal orders, we would have to look at this as case-to-case basis. And this is definitely going to be referred to our top management, the law unit, rather than being handled personally at the faculty level. But I guess, I think whichever you come from, I think we have heard from Thailand, from Indonesia, vaccination is the utmost that we need to get. And then from there, then at least we can go to nearer to our usual ways before the COVID-19. If without the vaccination, I think it's very far from what we're trying to achieve before COVID-19. Whether Dr. Panida or Dr. Inke wants to add on that, I think this is similar, not just in Malaysia, but in other countries as well. Please.
Yes. Okay. In Thailand, vaccination should be, the first. So vaccination and other measure from each place. As you mentioned, you can enter public places if you are not vaccinated. And the doctors here say that we have to live peacefully with COVID-19. So we have to have something. We have to live with them peacefully, and then with vaccination and with the way of taking care of ourselves. and then we can live with it without any problems. And some say that we might get infected, but with the vaccination, it is not that serious. That's all for me.
Totally agree. I said you get vaccinated does not mean that you cannot get the COVID-19 infection.
Yes.
Right? But you try to avoid the complications of the COVID-19.
Yes.
And I'm sure Dr. Inke will agree with me, coming from the, again, infectious disease background. Vaccination is not the foolproof of you avoiding the COVID-19, but more of protecting yourself from getting complications of it.
Yeah, I agree with Prof. Yazid, and sometimes like this is that we have to promote to the public, because they heard about like people who has been vaccinated and still get infected, and also what is the use of being vaccinated, vaccination if you can still get the infection. Well, actually it reduced the numbers of people hospitalized, reduce also risk of complications and deaths, and it is still very important. And out of all of the people get vaccinated, I think the numbers are people still get infected is still it's very depending on which vaccine you use, and this kind of information sometimes don't get to the public, and while like the hoax like get spread very easily, and the right information and like involving not only from the people from the university, and I think especially students who are more active in social media and communicating with other people, it will be a good, they will be a great advocate to tell about this vaccination. Yeah. And unfortunately, like in Indonesia, we don't, the vaccination is not compulsory yet. So at the beginning, there were so many rejection from the public for being vaccinated because they were afraid. But after a while, like there were more interest in the public, but now the problems is different because we don't have enough vaccine. So people are getting angry because they are waiting for so long to get vaccinated. Yeah. So sometimes we are also afraid of promoting this aggressively, because then when they ask like, where is our vaccine? And then we don't have it.
Thank you for sharing all your thoughts about this, and the fact that everyone plays a role here. I mean, the panelists, I mean, have shared the university's perspectives. Our student representatives also have shared their efforts in together tackling the COVID-19 pandemic, which is has affected many layers of society. And before we come to the end of the forum, I would like to, ask whether anyone would like to add on to existing discussion on this issue before we end our forum.
If I may, can I start?
Yes.
Okay. The COVID-19 is here to stay. All right. We have to live with them peacefully, with all the SOPs on board. And because of that, virtual learning is also there to stay. And I think a lot of universities are also trying to look into that positively by having more ODL, we call it, distance learning, online distance learning. And I guess students have to make full use of that. No matter whatever the disadvantage, no matter whatever the challenges that we talked about just now, infrastructure, timing, and all that, every one of us have to find ways to try to overcome all this. And I believe having this kind of forum, understanding what other people are doing, trying to find all the positive things and learn from that is so important. I think with this 1.5 hours being here today, I've learned a lot from our Indonesian colleague. I've learned a lot from our Thailand colleague. And I guess this kind of forum need to be there, not just at the top management level, but through the students level, be it the students in science, be it the students in non-science subjects. Things need to be talked through. We have to talk through all this. We have to talk about it so that our mental health gets better. The more you keep it, the more you resist it from coming out, the more problem that you will have. So
Yeah.
I guess this is something that all of us have a role to play. Thank you.
Panel members, Dr. Panida.
Yeah, I totally agree with you. I think during this period, be positive and understanding. And as you say that I mean, as the top management, we do our best in order to help everyone. And as a student, I would like you to take, I mean, the most of everything that you are going to get, and then try to see the bright side of this pandemic and try to improve yourself. Yeah.
Thank you. Yes, very important to remain optimistic. Yeah, although.
Yeah.
Thank you.
Yeah, and if I may add, like I also agree with Prof. Yazid and Dr. Fani that we know that COVID-19 is gonna stay, or at least for some time now. We don't know how long. And I mean, from the epidemiology perspective, we expect that the COVID-19 would be endemic, just like the influenza pandemic. And until it happens, I think everyone has to contribute. Like everyone has to work together to mitigate this infection, because if people are being tired, exhausted with this pandemic, it will be very difficult to control this. And our hope, like to live the old normal life, is going to be very it's not, we won't see it in the near future. But of course, I think like to go back to our previous life I don't think it's quite possible. So like our new normal would be like living with this COVID, with the health protocols, and we have to accept that. And I think it's been 2 years, and it's everyone has to support their peers, because we have all need to work together against this together. We cannot do it alone, and everyone not only needs like physical support, but mental support is also very important.
Thank you, Dr. Inge. The fact that we need to do this, I mean, we can't do this alone. Everyone needs to somehow contribute and work together, as we have seen examples earlier. And from student representatives, Dr. Clara?
Yes, thank you, Dr. Aislinn. What I can add as a student is from this online learning, you have to be comfortable in doing it. Don't forget, even though learning only takes place at home, it is important to stay on pace in every task that you do. However, it's still very good to balance it while maintaining your health, exercising, and spending time with your family or your loved ones. Don't burn out and fill your minds with negative thoughts, but you have to stay positive and hope this pandemic will end soon. Thank you.
Thank you, Dr. Clara, for a good reminder of all of us, not just students, for everyone who's involved in this education sector and outside education sector as well. Last but not least, Mr. Keng Hong.
Yeah, sure. So to add on from Dr. Clara, so always take care about our mental health and get enough rest throughout the online learning, and don't be shy to seek help from management, from your friends, and even lecturers. I believe they are willing to help at any time. Yeah, that's all for me.
Thank you. It's very good that you mentioned the fact that we all need to seek help. Students, lecturers, anyone involved in the situation where virtual learning is taking place, management is being done remotely, everything that is encompassing the university ecosystem. We all need to be prepared and be working together, adapt to this new normal. And before I end this forum, I would like to thank all the panelists for joining us today, for sharing our insights, for the stimulating discussion, although I wish we could go on and you could all add further to your insights, but time is limited and we have to end the session, unfortunately. I also would like to thank the attendees today, and of course, Mr. Malaya, Ministry of Higher Education, IMTGT Uninet, for organizing this forum, and hopefully this stimulating discussion, this ongoing dialogue would be evident in other forums in the future. Thank you so much.
Thank you, Dr. Azlin, for moderating the forum. And I'll also like to thank all the panelists for contributing in today's discussion. And to all the audiences, thank you for participating. And before we end, let's take a picture again.
Cheers to everyone. Give your brightest smile for our quick photo shoot session. It's a minute. Okay. Okay, so be ready in 3, 2, 1, smile. Okay, let's see with that. Can we take just one more, just in case? Okay, so smile in 3, 2, 3, 2, 1. Wonderful, wonderful. Okay, I've seen that.
All right. So before we end, I would like to remind the participants once again to fill in the form that has been sent by the Secretariat in the group chat, for your e-certificate. So I guess that's all for today. Thank you, everyone. See you again.
Thank you, everyone.
Thank you,
Thank you,
bye-bye.
Stay safe.
Thank you,
and see
everyone.
again
Yes,
soon.
you, everyone.
yes, yes, yes. Bye bye.
Bye.